everyone, my name is Ruby and welcome back to my channel. Today I will be talking about occupational therapy for all those who are interested in the field. What is occupational therapy? Who can become an occupational therapist? Where would it be practiced? These are all the questions I will be answering in today's video, and I'm so excited to take you along through this educational journey. I am a student currently in my OTD program. I'm in my third year actually in my second field work. So I'm very excited to be able to educate you all on through my definition and my experience of becoming an occupational therapist and being able to help a couple of others get on the way. So if you're interested in this video, please stay tuned. Okay, yes, so what is occupational therapy? Occupational therapy has as many definitions, it has as many experiences depending who you talk to, what area they're practicing in. As a student, occupational therapy has its definition that I will pop up here from AO, and it's aota.org. There you'll be able to find more structured definition, a couple other things that they're doing, encouragement of students that's interested in it, and yes, and how this all comes into light. For me, in my experience, I learned about what occupational therapy was through my aunt, who's actually in the healthcare field. She's a nurse and she has worked alongside some occupational therapists in a hospital setting. I started my journey to occupational therapy when I was a junior in undergrad. So I knew I wanted to work with children. I knew I wanted to work in a clinic setting, and I tried down the route of education with children, but I found that that's not where a lot of my desire was, really trying to figure out what I wanted to do. So here I am, a junior in undergrad. I'm majoring in exercise science with an emphasis in health fitness, and I end up getting connected to a grad student at Grand Valley who was an OT grad student. And me and her had like a Skype call for about 2 hours. And it was so funny because she was like, it's so hard to give a definition of what occupational therapy is unless you're actually a student, learning and practicing in the field, because we just do so many different things and we're just so creative on how we offer our interventions, which are pretty much like interventions in so many ways is pretty much like our design program. It's our design program for our clients whom are in clinics or schools and things like that, or patients, or that's people that's within hospital. She was telling me that, and I was asking her all these questions, and by the time at the end of the Skype call, I was like, I want to be an OT. Where do I sign up? Where do I start? What do I do? So I continued to major in exercise science with a health fitness emphasis, and right before I graduated, number one thing I would definitely advise is to become an OT or PT tech. Those are the people that work alongside occupational therapists and physical therapists day to day at a clinic. I think in hospitals there are also OT PT techs, but in my experience, I was in an outpatient clinic at a pediatric outpatient clinic. Pediatrics are meant for children. So I spent maybe like a year and a half there, and that was awesome. I got to understand the language, different interventions, and understanding the breakdowns between all of them. I'm going to do a video definitely diving into pediatrics, adult geriatrics, and things of all alike. So peds is where my heart is. Peds is where I would definitely want to go into, and I'm happy that I started in an outpatient clinic just to get not only to get the experience of being an OT PT tech, because I also help PTs as well, but to get those hours. And also the second piece of advice I would say is start your observation hours early. I would not advise that you need to rush and do this while you're in undergrad unless you know for sure that you want to go straight from undergrad into grad school. I personally took off a year, and then it took me about another year and a half, maybe even 2 years to get into school. I would say reference my video. I'm probably gonna put the cards maybe up here for my other video I created a couple years ago about me getting into the University of Michigan Flint Occupational Therapy doctoral program. So I'll definitely say use those years wisely, and that would help you to be able to not only get your observation hours, which most programs are asking for 40 to 60 hours, but to also get like that exposure, so when you get into school, you won't be too much of a shock of kind of what's going on. Also, if you're OTPT tech, you can use your work hours towards your observation hours. So yeah. So the next thing I would say is, what is occupational therapy? So occupational therapy, we help people get back to what activities that they find are meaningful. And that varies between different persons. So this is where the creative piece comes into play. When you think about occupation, you think about, oh, that's right, connected to work. Like, you can help me with my work. In a sense, yes, but occupational therapy, like I said, encompasses how do we increase your quality of life? How do we, from a rehab standpoint or rehabilitative standpoint, how are we going to create an intervention that would help build our client to getting back to areas where they find are meaningful to them, allow them to have the independency, allow them to be able to live a life that they feel is fulfilling. And one thing I did learn as far as the difference between occupational therapists and physical therapists, and if you are OT or PT watching this video, please go ahead and comment below. Let me know your take on this. But I was taught when I was in my IPR rotation that physical therapists help build the muscles, and then occupational therapists help you learn how to use those muscles in order to do a certain task. For example, let's say we have a patient that became ill or got into an accident and no longer has the ability to be able to stand the length of time to be able to brush your teeth. So from a physical therapist standpoint, they are looking, just in a general sense, they are looking for the strength. They are looking for that core stability. They're looking to see if your agonist muscles and antagonist muscles are working in the right way to be able to keep you standing in an upright position and safe for when you start to mobilize your body, moving out of your base of support. Occupational therapists, we're not only looking at that core strength, but we're also looking to see, okay, are you able to reach out of your base of support? Are you able to do your motions of your rotary motions, your being able to flip the toothbrush? What does your wrist look like? How is your body positioning? Are you leaning on the sink, or are you able to stand upright? How does that look when your sensory system, when you are brushing your teeth, how does that feel in your teeth? You know, just so many different things like that. What does it look like when your body is tilting forward and coming back up? Are you dizzy? Are you lightheaded? Do you feel like you're about to pass out? So these are all things that we are definitely looking into, like that sensory piece. We're also looking into the strength piece, but in a different way. So occupational therapists and physical therapists, I like to say that they are siblings, but they're looking for different things. Within the sphere of occupational therapy, we have what we call OTAs, which is occupational therapy assistants. We have CODAs, which is a certified occupational therapy assistant. You can become, from my experience, and please correct me if I'm wrong, from my experience, you can have a bachelor's degree and then you can become a OTA from an approved community college or a university. I know here in Michigan, in the region that I'm in, I was considering becoming an OTA, a CODA, after I had graduated. I was having difficulties as far as like when it came to the whole application process, because the longer that you're out of school, the more that your prerequisites can either expire. And that's another thing. You don't want to take too long being out of school, because a lot of your prereqs that you took in your sophomore year, your early junior year, they start to expire after so many years. And 10 years can pop up, or 6 years can pop up very fast, especially since when you took that class, and if you don't want to have to retake the class, then you want to make sure that the school that you're interested in, number one, requires that prereq and at what grade level they require it, and seeing if you're able to use that course and use another course to, you know, compensate for that one if you had not taken it. But yeah, going back to OTAs and CODAs. So and CODA is a certified OT, like I mentioned. After I graduated from Grand Valley, application process, yada yada, I was going to apply to Macomb Community College. at their main campus, and there is a standardized exam that you do have to take. And then the program, I have to double check how long the program is, but there is a program that you go through, and you go through the exact same rigorous courses. You go through the whole beginning parts of the year. Like you always start off with anatomy and physiology, neuroscience. I think you go in, that's neuroscience, I think it's in your second year. But you start off with there, you work your way from peds all the way to geriatrics. And OTAs are definitely very much so prepared, educated. You can always learn some things from different OTAs. The difference is just when it comes into documentation and who can sign off on those different documentation, but they're very helpful, that's my best friend, I'll call her right back. OTAs are very much so educated within the field. They usually have a lot of experience, and you can definitely learn from them as well. Then you have your Master's of Occupational Therapy, which is you do have to apply to get into as well. There is no standardized test to get in, but you do have your traditional prerequisites, and you do have your hours of observation. Like I mentioned earlier, 40 hours I've noticed with a lot of universities here in Michigan and in the region that I'm in, but it's always great to get a little bit more in the event that you want to apply to other universities and you don't want one saying, oh, well, we need 60 hours and you only have 40. So Master's of Occupational Therapy, they have the same rigorous courses. They are 2.5 years, and they have 2 field works. So once you complete your last field work, then you graduate and you can be a flourishing occupational therapist out into the world. Then lastly, you have your Doctorate of Occupational Therapy. As far as from the state of Michigan, the University of Michigan Flint was the first school to be able to have an occupational therapy doctorate program. We do the exact same thing as the master's programs, but we have a capstone at the end, which is where we do our capstone, our research, applying what OT is and how that can help our areas of interest for research into either different organizations or programs or whatnot like that. So we have it's a 3-year total program. The first 2 years is academic courses. Then the last year I had my field work in the fall at Henry Ford IPR location, and then currently I am at a pediatric therapy clinic, outpatient clinic, and then my last capstone is going to be at a organization here in Detroit. So the best thing to do, guys, please advocate for the fact that you want your field works in the city that you live in, because you will have to cover your living expenses. But I'll go into that into another video. But yeah, so now those are the difference between your COTAs, MOTs, and OTD. I believe I went over, yeah, you have your inpatient, which is usually IPR, which is inpatient rehab. We see hospitals, and then you kind of have like your SARS right after, where someone is not able to go right from the hospital straight home. We have like that second step. In the hospital, typically people are only really stay there unless it's something that was major that happened, usually about 2 weeks. So the interventions are not as intensive, but it has been shown through research that early intervention definitely aids in increasing how the body responds to therapy and fast healing. Then you have, like I mentioned, the outpatient clinics, then a couple of other different areas too. You have which is emerging practices. You have your OT doulas, which I thought was amazing, because I would like to focus in with mothers who are expecting, so that OT can be able to build and help grow that area of the process before or process of during pregnancy, during the birthing process, and after. Doulas definitely advocate. Occupational therapy doulas are looking for the body mechanics, the ergonomics. What is it that the mother needs in order to translate her new experiencing physical form and when she's going back into her occupations, where your occupations vary, of course, what I mentioned. And just so many more, guys. So I will, of course, add some more information underneath like the like for the description, so you can see all the areas and all the new emerging areas that we are practicing in. Researching the school that you're interested in, what are their requirements, having a meeting with those, either if it's virtually or going up to the school, is definitely helpful to meet with the program, ask them what are some things that they're looking for in students, and I'll of course make a video about the application process and what does that look like with OTCAS. I have my own feeling and my own beef for OTCAS. I'll talk about that too. So yeah, and yeah guys, so I'm really excited about that. Definitely look forward to a video of application process. What do you want to have encompassed in your paper? How is it going to better represent for you? How to better represent for yourself when you're in person or through tele interviews for OT school. OT school is such an amazing experience. It can have its difficulties, so I'll also talk about some off the record things as well, but just wanted to get you guys to dip your toe of what occupational therapy is, how it can not only be beneficial for people that are in a rehab or rehabilitative state, but even for us. Like, I've learned that there's some things that OT has definitely helped me with, and I've started to apply to my everyday life as well too. So if you guys are interested in more videos about occupational therapy, please stay tuned. Check this video that I filmed when I first got into OT school. I'll have a lot of background as far as myself and my journey then. And yeah, so if you have any questions, please comment, like, and subscribe. Stay tuned for all of my wedding vlogs. I'll be getting married this year. I'm so excited about that. So this year is definitely going to be a large and exciting year for me, and I'm definitely excited to take you guys along the way. So yeah, I'm happy you stay tuned, and I hope you like this video. Talk to you later. Bye.